When someone is suffering, we sit down with them rather than standing over them, where we listen, and through our active listening skills.
You're with them.
You're with them,
yes.
and you demonstrate that. So how hard is it? When are you ever taught how to listen to yourself?
This season, Ripples, Physician Wellbeing will focus on the theme of facets of compassion. Compassion for self, others, and society. The Long School of Medicine Office for Graduate Medical Education utilizes a compassion course to combat feelings of imposter syndrome, guilt, or shame with challenging patient outcomes, as well as teaching mindset adjustments to promote higher self-kindness. For each facet of compassion, we'll provide you with an episode about recognizing when an instance can require grace and the pebble to activate it. We're happy you're with us. Let's create some ripples.
It's such a great honor to have our special guest today. We have Dr. Jason Morrow. He's an associate professor in the Department of Medicine, and he's a palliative care physician. And he also is the director of ethics for UT Health in the Cheever Center of Medical Humanities, which we all know. You have had some wonderful guests from that program. Welcome to this program, and we're looking forward to talking with you today.
Of course. Thanks so much for having me.
We are so curious about what you can teach us about self-compassion and what you can say to us. And one of the first questions I have is, I hear that you have training in philosophy and ethics, and you are a palliative care physician. So how has that knowledge that you have and those perspectives have helped you in building a concept of self-compassion?
Wonderful. Well, thanks so much. I'm in great company here, and this is super fun. I can tell you a little bit about just my orientation philosophically, ethically, and in palliative care, and then how that relates to the concept of self-compassion. I'll acknowledge that I am not a scholar in psychology. I don't know research related to psychology very, very well. I'm a little poppward in terms of my application of what I know to self-care and to mental health, but I do have some moorings.
Kind of tell us about components of self-compassion.
Sure, and I should acknowledge I get no credit for this. Dr. Kristen Neff, who's available on the web,
right.
she's got the
Yes.
source materials for this. But I do put my own spin on it, and I did find it because I felt it resonated with what I wanted to work on with residents.
Yes.
And let me build a bridge here between that very philosophical attitude and the interpretation of suffering that was advocated for by Dr. Eric Cassell. I don't know if you've read his work, but he's got some really great material on the nature of human suffering and the way medicine steps into the space of suffering as a healing art. And he's capable of finding meaning in caring for people even though they're suffering. And there's a beautiful acceptance of suffering in the world. We tend to put it on our shoulders when we're physicians, right?
Yes.
Any death, any suffering must be our fault. And we're trained that way. There's this very strange model of medicine that's very heroic and on a horse riding into rescue that we're beholden to, and it really doesn't serve us very well. And Eric Cassell really wants to put suffering at the central heart of the service of healing.
Yeah, and I want to interrupt you there for a second because our residents need to hear this, and they need to hear it now. Faculty needs to hear this, and they need to hear it now.
People
and
need to hear it
yes.
about suffering.
And it makes so much sense how you started talking about suffering, and I was thinking already how beautiful to present that part of being human and to find that connectedness between all of us through suffering, because that's also part of the human experience. And it's true, we cannot get rid of it. Suffering is part of our human experience. So sorry, I just...
Well, no, it's part of it, and I'm glad you helped us emphasize that point. We have to have enough humility to recognize that we cannot make all the suffering go away.
Yes.
But we also have to recognize we're strivers. We're pursuing a goal. We want to relieve suffering, and that's the North Star. That's the wind in our sails. That's what orients us as physicians. You sign up for a service industry, and it just doesn't have to be medicine. It can be any industry oriented towards the service of others, whether that's mental health or social services, or honestly, there's not a single job in the world that you can't do without an intention of feeling connected to a larger mission of helping humanity. So I do think we need to relieve ourselves of the need to rescue everyone from suffering always. I do think that it's a tension, though, because we also need to hold on to the ways in which we are responsible for relieving the suffering of others. And when you're a physician and you put on that white coat and you wear that badge and you walk in and you provide service and you're going to get billed for it, you are absolutely on the hook for relieving the suffering of the person in front of you to the best of your ability with all the standards of care and the technology that you bring to bear. And that's really important in a broader sense, because that's why the office, the station of the physician exists in the first place.
Yes.
Right? Society has said, we're going to give you privileges to do really bizarre things.
Yes.
You're going to put these poisons in people, you're going to cut them open, you're going to do all these things, and you're going to bill for it.
Other people do it, but yes.
Right?
You can do it.
And so why? Why would society create that really powerful station? Well, they do so because they know that there need to be people among us who dedicate their lives to the expertise and to the craft of healing others. This is the sort of Good Samaritan perspective. We're all responsible on the road to Jericho. We see someone suffering, as it were. Yeah. We should render aid. And that should is imposed on us by some sort of common morality. And wherever you derive your metaphysics to ground that could vary.
Yeah. Yes, that's so nicely stated, Jason. So this again, I'm bringing us back to the three components you talked about. Self-compassion, because you said once you go into that with white coat, you have this, you want to alleviate suffering of everyone. And then we become so hard on ourselves. So you talk about three components of self-compassion. Maybe name them and explain that to us.
They are just all expressive. They are facets of this jewel of service towards others. The self-compassion is no different than the compassion that we feel towards others. And Kristen Neff will tell you that when she talks about these three faces. So the three faces, these three dimensions or domains, and this comes from Kristen Neff, are self-kindness versus self-judgment. And this talks about the sense of being kind to yourself. And this isn't rosy, romanticized kindness, just cheer yourself up. This is the type of affirmation that is sincere, that looks inside and says, you bring good things to the table here. You are fallible, and that's okay, right? Being nice to yourself the way you would be nice to a good friend, right? And it's really important that we recognize that this is a central act. It's a vital act, not something that's superficial and just a gloss over this sort of inner narrative, inner dialogue that we have. The second domain is common humanity versus isolation. And this connects with that sense of loneliness that privation can make us feel. We feel alone. And think about when you stub your toe. The first thing you do is you grab your toe and you sort of turn to yourself. You're not thinking about anything else in the world. When you are late to a meeting and you're rushing there and you're sweating, you're thinking about you getting to that meeting. You probably should render aid to your toe, and you should probably get to that meeting safely, right? Yes. But you can also avoid the trap of this sort of nihilistic doubling down, where you punish yourself for going through the experience that you're going through. And when you do that, when you kick yourself while you're down, you make yourself more lonely and more distant from other people who may be similarly situated, going through the same thing, because they are also fallible. So that common humanity becomes this sort of counterbalance to that individual isolation that we tend to feel. So the first two domains were self-kindness versus self-judgment, and that was one facet. The second was common humanity and isolation. And the third is mindfulness versus over-identification. And mindfulness is kind of like a presence, a willingness to expand your cognitive and emotional capacity for being attentive to yourself, like treating ourselves as if we were a good friend. Where is your friend's head when they're talking to you to offer you support? They're thinking about you. They're wanting to buoy you up. And sometimes when we fail or when we suffer, we so identify with that negativity that we fail to be present. It's like you just awfulize, you catastrophize, and you sink into this well of darkness. Well, if you, instead of over-identifying, take a moment to pause, feel yourself in the moment, to breathe, then that mindfulness can be restorative. So you can see how these three faces are really dimensions of the same underlying experience. And it reminds me of the Eric Cassell's approach to suffering. We talked about him earlier. So he's got this lovely way of approaching suffering where we, in our shared experience with our patients, with the people we serve, seek to transcend suffering. And the transcendence is what helps us create meaning, right? You think of a higher purpose, or you look up. I think it's beautiful, and I think the great religious traditions teach us to look up. They talk about transcendence and ascension. Transcendence is just as important as immanence. And immanence is where we dwell. And I don't mean dwell in the over-identification, the rabbit hole that we can fall into. I mean presence and immanence, as in when someone is suffering, we sit down with them rather than standing over them, where we listen, and through our active listening skills.
You're with them.
You're with
time.
them,
Yes.
and you demonstrate that. So how hard is it? When are you ever taught how to listen to yourself,
Yes.
to give that space for yourself to express your fears, your concerns without judgment? And that's why in the module, we go through the exercises, we go through practices that help us just carve out a little space to practice a more healthy inner dialogue.
Yes.
My head is about to explode, I have to say, and I get super excited with these topics and the beautiful way you're talking about it. I hope I'm not jumping to ahead. It's sounding to me that what you're saying is that difficult line to walk between, accepting suffering as part of the human experience, but also wanting to overcome or to transcend suffering, to learn from it, to create meaning. That compassion might be one of those guiding principles that are going to help us.
Like he talked about, right?
Exactly. It's going to help us figure out that, am I ignoring the pain of my resident because I just don't care? And that would be a problem with accepting suffering. Or am I completely compassionate, understanding where my patient is going and what he's going through, but doing my best as a human and also understanding that I'm doing the best I can. I don't know if it makes sense.
No, that
you
makes
do.
sense. That makes sense. When we have deep pain, when we
Yes.
have grief, when we have
Yes.
loss, when we have intense fears, sometimes we just linger in them in such a way that we just keep saying, this stinks, and I hate the situation. And we just let it linger and freeze us up. It can weaken us. It can diminish us. It's okay to have those thoughts. It's okay, right? I'm not saying that you should then beat yourself up because you have a negative thought that lingers, right? Sometimes the grief is so intense that it's going to recur.
Yes.
But we have to respond to that intense fear, to that intense grief with some sort of healthy language. And when we give ourselves some space to do that, what we find is it's not that the grief or the fear goes away. It's that we expand to accommodate it.
Yes.
Again, we come back to every module, or we say
Yes.
reaction versus respond. We tend to react rather than responding to things. When we take time to look at whatever within us, then we can respond it effectively.
We need to be self-compassionate. We need to be careful how we talk to ourselves. So how come you share with us a video by Dr. Drummond that says we need to treat ourselves as a dog?
Yeah, that's great. No, it's a beautiful video. I recommend watching it. It's a little geeky. It's a lot geeky, okay? And it sounds offensive at first. But what I love about it is because he puts us in a frame of mind where, think about how you feel when your dog greets you when you get home.
Yes.
Right? Or you throw the tennis ball and your dog gets the ball. You are all affirmation, right?
Yes.
So it's that just little joy that you give yourself, that little affirmation. That's what he's talking about.
Yeah.
Is where you just acknowledge you did something okay. And I think that's the other failure here, is not just the doubling down or kicking yourself while you're down, but we also don't find opportunities sometimes to just say affirmative statements. We pass by them. We pass by those moments. This video works really well with medical students and residents because the secret to residency, and I can just tell you this is the skill you learn, is you learn to make little check boxes and then you go check them, right? A patient had a low potassium and you remembered to supplement it. You check that box and you're like, yeah, I did that, right?
Small victories, right? In a way.
Absolutely. It's the small treats and it's an affirmation, but it's not false either. You actually did something.
Yes.
Right? So you don't have to feel like you're just blowing smoke or being false with yourself.
Sure. Yes.
And that's the central story of his video, is to find the little things that you do well each day and give yourself some credit for it. We just tend not to do that. So if we spend all of our time in a negative space and no time deliberately building ourselves up, then what do we have to hold us up when the going gets really hard? That feeling of accomplishment, of discharging small duties and responsibilities, can actually build an edifice, a foundation for allowing us to be stronger when the winds are strong or the forces are intense against us. It can be very healing.
Yes, I mean, I love the way you put it. It again reminds me of something that when we acknowledge small things, small victories of anything, or when we acknowledge small things and notice, appreciate it, and then they all add up, and then it's not so bad. And we always talk about, look at the things that you have already made changes, and they will say, yeah, I have never realized all these changes were done. Mm-hmm. So you put it so well, Jason. And I have also heard so many things, we hear from residents that one of the favorite exercises you give the participants is to write a letter to themselves. And I know when we have to write a letter to ourselves, it's hard because we always look at all the negative things. But as if you're writing a letter to yourself to see all their sacrifices, dedication, and all the positive qualities. And tell us the experience, and then have you come across something that was really made you feel like, oh my God, this has been a great exercise?
Yeah, absolutely. Again, the clue here came from Kristen Neff, but I love it. I put it in a frame where you think of yourself as a series of selves over time. Are you the same person you were when you were a child? Are you the same person you were when you applied to college, when you got into medical school, when you completed this module? You are in some ways the same person. Who else would you be? That can't be a different person. Who's the closest person to that one? This one.
Yeah.
But at the same time, you've grown.
Yep.
You've changed, sometimes in important ways, and you
evolved.
You evolved, right? Exactly. So I orient this exercise with thinking about yourself over time and thinking about how you narratively construe yourself from that prior point in time.
Yeah.
Right. So you may have set out early to say, I'm going to achieve this great thing. Well, should you be beholden to a promise you made to yourself when you were 8 years old? Right? What the heck do you know, yes, right? Yes. At the same time, that may have been something that over time you affirmed over and over again. You jumped through the hoops. You did the jobs. You submitted yourself to other people judging you to make it further down this road. And here you are. So who is it that is invested in this current self that got you here? Is it the person that committed initially? Is it the person who's committing now? What if the commitment has wavered? What if in the course of getting to this moment and through the trials, the tribulations, the successes, you've changed in terms of understanding what that goal means or who you are? Maybe you've discovered a different path. There's a lot of inner dialogue that happens in that, a lot of inner dialogue, and you can be self-congratulatory, look what I did. You can fail to give credit to the other people who supported you to get there, and you can be very critical of the failure. You could get all the way and still be very critical. And the system, especially in the service industries and especially in medicine, it's designed to project that sense of reward towards an external source.
Yes.
The sense of reward comes from externalities. So the concept of self-affirmation, again, that's a practice in being internal within your own sense of affirmation.
It is so validating, too, for them when they start writing. And all our thoughts, in a way, are nebulous. And when you start putting on paper, it's like this is a way of journaling is a very good therapy, too. Yeah. So you're doing so many things with one exercise for them because they're thinking about it. They're also talking about themselves and say they're kind to themselves. Yeah. And they're validating their feelings.
Yes.
And it's a beautiful way of what you have asking them to do.
Learning
Validation
from inside.
Exactly.
It doesn't have to
it
be
doesn't
external.
have to be outside. It has to be. It has to come from inside too.
And importantly, it has to be practiced deliberately.
Yes.
So you mentioned the palliative care earlier. So in palliative care, we talk a lot about the deliberate practice of empathic communication. And this is about learning specific communication techniques related to active listening, the choice of words that you use, the space that you create. You mentioned emotional intelligence earlier, which entails having a sense of what's going on inside of you with an eye towards exerting some sort of control or management over that, and of understanding what's going on around you in a social situation, being attentive, noticing what's happening, and then responding to that, right? These 4 domains of being aware, but also responding to inside and outside of yourself. The skill of communicating, it takes practice, and not just once, but over years, and it must be done deliberately. When I was a kid, I grew up doing Taekwondo because my brother ran a karate studio. I'm not a black belt, and I do not want to get in a fight with anybody. But I did know that we began every class with meditation.
That's right, yeah.
And then every class was rote, disciplined repetition to get better and better. And then you can grow, you can connect skills, and that concatenation of attentiveness and presence with the physical movement in a physical space is what helps you internalize the art and the craft.
Yeah.
Same thing with communication, and in this context, with that inner dialogue of being kind to yourself. It just takes practice, and it has to be deliberate, and it is edged out through professional training as if it's a weakness or if it's an also-ran. But it is not. It is central, because the self that is going to be healing people for a living must be able to heal itself first.
We always end our episodes with what we call a pebble, a little rock that you can throw into the water, and that's going to create ripples that hopefully are going to help you find wellness and help others find wellness as well. So we want to ask you if you would like to leave a pebble with us today.
So the pebble I'll leave is, first, do no harm to yourself.
Amen.
And
Yes, I know.
And what I mean by that is, be compassionate to yourself first. Let's recognize that all of us are here because we want to help others, and we can get very caught up in that. It can, the system can take advantage of us because of that. As a result, we must be the first advocates for ourselves. So I'll give an example for me. I tend to schedule a lot of things back to back with no room in between. And that's because I want to do all the things.
Yes.
And let me tell you, I don't leave enough room for myself in that. I routinely disappoint myself and others because I'm late for a meeting. I don't make another meeting, or there's a conflict that I missed because I'm like, oh no, I didn't realize I was missing that. The practice I need to exert to avoid hurting myself and hurting others and not staying in this marathon is to create gaps, deliberately create spaces where I'm going to have wiggle room. Yes. The truth is, I'm late to a lot of things because on the way to those things, something else comes up, right?
Yeah.
When you give your phone number out to patients and families, you're going to get called, right? I'm the sort of guy when I'm driving along the highway, if I see an accident on the side of the road, I'm going to pull over and see what I can do to help. Yeah. I'm going to be late for some things. So I need to create deliberate spaces where I can have wiggle room so I don't set myself up for failure. Sometimes that means for the studying or the taking of online modules or for exercise or for preparing a meal that you enjoy or being with a loved one or walking that dog.
Or drinking water. So many of our residents don't even have time to drink water. Yes.
Set yourself up so that you can care for yourself throughout the day. And that can mean scheduling 15 minutes in the morning and 15 minutes in the afternoon that are just unscripted, where then you could do something that came up during the day. Or you can go fill up your water bottle because you already went through it because you've been working all day and hustling. So that would be my little pebble, is to avoid harming yourself by giving yourself the wiggle room to attend to yourself first. If you don't attend to yourself throughout the day, every week, every month, every year, you don't give yourself space for joy and peace and patience and self-awareness, then you're going to continually beat yourself up, and you're going to potentially disappoint and frustrate your desires as you work towards being a healer.
Ripples Physicians' Wellbeing is made possible by the Joe R. and Teresa Lozano Long School of Medicine Office for Graduate Medical Education. To contact us or learn more about the Wellness Home, visit gmewellness.utesca.edu.
This podcast is inspired by the Dalai Lama's powerful quote, "Just as ripples spread out when a single pebble is dropped into water, the actions of individuals can have far-reaching effects." We provide physicians with pebbles, tangible and actionable practices that can help make positive impacts in their personal and professional lives.